Hello, and welcome to Next Generation Behavioral Health.
10-minute tips for modernizing patient care.
I'm Dr. Christina Armstrong.
And I'm Dr. Julie Kinn. Christy and I work in the Department of Defense on a team that builds mobile apps, websites, and other technology for military, veterans, their providers, and other beneficiaries.
And our team also travels across the country to train military providers on how to integrate technology into clinical care.
And in this podcast, we share answers to the questions we hear, and we try to do it in 10 minutes or less, or you get your money back.
So today's topic is, what is the evidence base to support mobile applications in clinical care?
Exactly. Is this just a great idea that we had, or do these applications work? So, Christy, do they work? What's the evidence?
The most important thing to know about the DoD and VA developed mobile applications is that they are all built on a really solid evidence-based foundation. So any of the mobile apps that are built, they are built using practices that us as clinicians would normally use.
What do you mean?
Yeah, that's a great question. So as a provider, if I'm working with a patient that has problems with their mood, if they have bipolar disorder, for example,
Okay.
first thing I'm going to have them do is track their moods. So that's something, just a normal part of cognitive behavioral therapy, is just tracking of symptoms initially. And so in a mobile application, what I would do is have them track their moods within the application.
So it's not some newfangled random treatment. It's just an electronic version of something we were already doing that already has an evidence base.
Exactly. Yeah. And there's no way that the DoD and VA is going to build something that doesn't have a good, strong evidence-based foundation to support what's inside of it. And that's what's so great.
Okay, well, we're going to come back to some stinkers later on that might not have that background from external to the DoD and VA. You know, as I know that as we were preparing this episode, Christy, you had presented a very, very long literature review of all the evidence. And there is a lot of evidence out there. We're not going to go over it all today, but we will put it in the show notes. And of course, you can go to our website, t2health.deco.mil, or just Google T2 Health to see some of our relevant publications. So it sounds like some of the apps do have tools that are already evidence-based. But of course, some of the other apps are based on evidence-based treatments. We're going to be using the words evidence and based a lot today, I see. Like prolonged exposure coach, or PE coach, for the prolonged exposure treatment for PTSD that we've talked about before. That's an evidence-based treatment from FOA et al. Sorry, I inserted a reference. But the PE Coach app is just an appification of that evidence-based care.
That's right. So, Julie, I'm curious. So when providers ask you, because I know you get this question a lot too, what do you tell providers that ask about the evidence base for these tools?
One of the most important studies is one that our colleague Nigel did, Nigel Bush, that showed that entering data on surveys and assessments online or on pencil and paper or on a mobile app, they all get the same data. It's equivalent data, which means that really doing self-assessment or having our patients track data on their phone is going to be just as valid. So I think that's huge. It shows, yeah, we really can leverage these tools. Of course, not everyone's going to love using a mobile device versus paper. Some people will. So I think that's a really important part of the data. There's just growing literature out there. It's hard to do a randomized control trial of a specific app because, as we all know, those of us who do research, an RCT takes years. I mean, the IRB application alone, we're looking at months there. And technology outdates very quickly. Within a year or two, a mobile app absolutely needs to be updated. So you can't expect that every single mobile app is going to have an RCT, but we still need RCTs to look at the overall usage of technology. And there are some great research already published and in progress. And in addition, we need pilot and feasibility studies and shorter term projects as well to look at the whole range of research and evidence.
I completely agree. Another research study showed that not only are those equivalent to use in the app, but there's also improved validity of patient data. That means that if you have somebody take mood tracking or sleep tracking, and then they come into your session and let you know what the data is, you're not necessarily getting the most accurate data. The way you get the most accurate data is getting in the moment data. So having them track their mood in the moment when they're experiencing it.
Yeah, in their ecologically valid setting.
Exactly. Yes. As a researcher, I love that you're using the research. Yeah, you as a researcher too. Completely. So you said something interesting before. You were talking about the stinkers. So we know for at least the DoD and VA developed apps, we're going to brag. We don't have any stinkers, right?
Right. No, totally outside.
And with all of these tools, it's really important for the app creators not to mislead the public regarding what the app can do.
Ooh,
and so that's why, as part of the DoD, we're really careful with saying, hey, look, these apps aren't meant to diagnose. And we're really clear about that, because we're part of the government and we're going to follow all the rules. However, people outside of these government organizations that might have some financial stake in the game might not necessarily be doing that. So we all have to kind of be aware of that.
Okay, so without saying the names of the apps, tell us about some of the stinkers.
I would love to. I'll tell you some examples. So
okay.
This is one I've heard of that I thought was kind of funny. An app that you can hold your camera up, and you hold the camera up to your face and it kind of reads your mood like a mood ring. So, if you have bipolar disorder and you're not sure how you're feeling, this app is saying, oh, just hold your camera up and I'll tell you how you feel.
That's so much easier than just developing insight. I love it.
That's right. Yeah. And so, there's a couple things here. First thing is, does not pass the smell test. Like, you're just looking at that, like, not buying it. That doesn't, and because we're clinicians, it doesn't pass our smell test. However, who knows if there are people out there that they might say, oh, well, that's what the app is saying. I caution clinicians out there to just be aware that your patients might come in with these and to dig a little bit for them and help inform when possible. Have you heard of any stinkers?
I'm very interested in ones that claim they can cure acne using the light function. I haven't actually had success with that one myself, but I'm totally willing to test it out. Yeah, even though we're laughing at some of these, it just shows that some of our patients can be pretty desperate. And when you're in pain or you have a mood disorder, of course you want to try different things and see what's going to work. So asking your patient what apps they're using, even if it's not a DoD or VA app, there's other great ones out there too, and helping them vet them is going to be important.
Absolutely. I completely agree. So, are we getting to the end?
We are getting to the end. I encourage folks to look at our reading list that we're going to put in the show notes, but of course, connect with us offline because we have lots of other fun research we can share with you that we've done and that some of our partners have done.
We could go beyond 10 minutes and go to 10 hours on this topic.
Yes.
But we don't want to bore you all today. But if you are very interested, we'll give you access to that information.
This might be our nerdiest episode to date, and there's nothing wrong with that. If this is your favorite episode, that is just fine.
That's right.
Yeah. Well, thank you so much for joining us on Next Generation Behavioral Health. You can connect with us on Facebook and Twitter at Military Health. Thanks so much also for rating and subscribing to us on iTunes or wherever you get podcasts. Next Generation Behavioral Health is produced by the Defense Health Agency. Be sure to check out our other podcasts like A Better Night's Sleep and The Military Meditation Coach.